The party drug Ecstasy is being hailed as a breakthrough treatment for post-traumatic stress disorder, or PTSD.
Well, the FDA is expected to approve that treatment pretty soon, but not in Colorado. Political specialist Sean Boyd with us right now to explain this and explain why and what's being done to change that. So why not here?
So FDA-approved drugs are offered automatically in half of all states. Colorado is in the other half. That also requires state approval. Two state lawmakers are pushing for that in this case, as clinical trials show 67% success rate, even in the most severe cases of PTSD. 180 people have participated in the study so far, including the veteran you're about to meet, who says it saved his life.
I spent 8 years of my life trying to kill myself every day.
John Lubecki told state lawmakers he shouldn't be alive. An Army veteran, he returned from Iraq in 2006 with severe post-traumatic stress.
Put a loaded 9mm to my temple and pulled the trigger.
When defective ammunition spared his life, he tried to end it again and again and again. Then, in 2014, he entered a clinical trial thinking it would be the last thing he would do before he died.
It made me not want to die anymore.
He received MDMA, the active ingredient in ecstasy, and for the first time was able to talk about and deal with his trauma.
I mean, I know logically, third side bomb, all that stuff, I had nothing to do with. I wasn't even there. But he was one of my guys.
The MDMA puts the mind, body, and spirit in the place it needs to be so that you can heal and the therapy can actually work.
Boulder psychiatrist Dr. Will Vanderveer, who helped conduct the study, says participants received 3 doses of MDMA in a controlled setting. They then undergo more than 1,000 hours of therapy.
What's happening in those sessions is not fun. It's not pleasurable. It's fear diminishing and trust enhancing so that the person can actually do the work of the healing.
The treatment could get FDA approval by the end of the year, but it won't be available here unless it also gets state approval, which is why Representatives Patrick Neville and David Ortiz have introduced a bill to clear the way. Both lawmakers combat veterans themselves.
I think of veterans that I know that self-medicate with some horrendous drugs, and this is done in a very safe clinical setting and is proving to be extremely effective. I would much rather have them doing that than self-medicating with something much more dangerous on their own.
Or worse, end their life to end the suffering.
MDMA-assisted therapy is the reason that my son has a father instead of a folded flag, and I think Colorado needs more mothers and fathers and less funerals.
Now, if the FDA gives the green light, MDMA would only be available in a clinical setting and only in combination with therapy. Still, there will be opponents, and Lubecki says to them, if there was a treatment that eliminated 67% of tumors in cancer patients, lawmakers wouldn't hesitate to legalize it. The bill passed its first committee unanimously. Still has a way to go before it is law, but I think it'll happen.
Wow,
Kelly,
Sean.
Alan.